Good morning, students. This is lecture for 6th sem students. Nutraceuticals lecture 2. This I have updated for this 2024 batch. Previously the old class will be available in the online, but this is updated class. Just added some more points. Dear students, the viewers are requested, or humble request, to give a subscription for my channel so that it will helpful for me to make more classes for you with interest, and also you can give some suggestions which can be developed, makes me to develop more and more to reach the students with proper information. So then today Nutraceuticals lecture 2, after the introduction and the marketing details which we discussed last class, today we are going to discuss about what is its application, what are the possibility of nutraceuticals and its usage in various ailments. And today's topic I have taken specially for diabetic mellitus. So you know, diabetic patients are more in India and not on the whole world. It becoming a threat for various other ailments connected with diabetic mellitus. So we need to know about nutraceuticals and natural foods which are available, can be utilized, and herbs which are proved. There are many, but still I have selected herbal drugs and herbal formulations and nutraceuticals which can be used for preventing and as well as treatment of diabetic mellitus we are taking as a consideration for this lecture. So there are many ailments have to be discussed after this diabetic mellitus. That's why the topic says herbal health benefits and role of nutraceuticals in ailments, in which today's class nutraceuticals and diabetes. So diabetic mellitus, we are talking about diabetic mellitus, in which you can see lifestyle intervention and nutritional medicinal strategies are the primary determinants to prevent diabetic complications in pre-diabetic and high-risk individuals. A balanced nutrition or nutritional management consists of nutraceuticals and abundance of bioactive components like phenolic compounds, sulfur compounds, herbs, natural oxidants, natural antioxidants are involved in, not natural oxidant, natural antioxidants are involved in glucose metabolism, which may prevent progression of diabetes and other associated complications. Some of the natural supplements are already available in market, which are extensively prescribed by the clinicians. Example, L-carnitine, alpha lipoic acid, omega-3 fatty acids, berberine, chromium, soya, and phytoestrogens. So these are some of the examples. We are going to detailedly study about all these examples, how they are acting as a nutraceuticals in prevention and treatment of diabetic mellitus. So here I made it as a points so that the students can remember this slide in their mind and they can express the points which they are coming in the examination point of view. This is very important. So nutraceutical in diabetes, what all the points in this lecture the students have to remember. Instead of going for the summary, I am giving the initial abstract of the lecture so that it will be easy. This is my idea to give students to get some points to write in the examination point of view very clearly in their paper. So first one, nutraceuticals in diabetes as an antioxidants of vitamin C and vitamin E. And there are some discussion about even carbohydrates, how carbohydrates can act as a nutraceutical in diabetes. We know carbohydrates are the main thing which causes the difficulty in the metabolism and causes the need of insulin, causes the resistance to the insulin. But still, how a carbohydrate can also be utilized as a nutraceutical in diabetes can be seen today. Some of the research has shown, and fats and fibers, natural fibers, chromium, magnesium, alpha lipoic acid, vanadium, protein, coenzyme Q10, L-carnitine. So once again I want to make you to note it down. These points will be helpful for you to write in detail. Suppose if they ask 5-mark question or even in 10-mark question, what are nutraceuticals and what are the nutraceuticals having the role in diabetic mellitus or in various ailments, you can explain these things very clearly in point by point. These all the things which can be given application for the treatment as well as the prevention for the diabetic mellitus. So we have to remember about the antioxidants of vitamin E, vitamin C, how a carbohydrate can act as a nutraceutical in diabetic, how a fats, how about fibers, how chromium, how magnesium, how alpha lipoic acid, how vanadium, and how proteins, and how coenzyme Q10 and L-carnitine. And there are some anti-diabetic claim of herbs which are going to discuss in this class about Acacia arabica, Angel marmilis, Allium sativum, Allium sipa, aloe vera, Ananosa squamosa, Artemisia pellens, Astridica indica, Andrographis paniculata, Biophytum sensitivum, Beta vulgaris, Brassica junicea, Cassia auriculata. These all plants there are many, but still I have selected few of them which is proved to be anti-diabetic herbal drugs and herbal plants. Antioxidants of vitamins, vitamin C, ascorbic acid, everybody knows, is a chain breaking antioxidant. Scavenging, blocking, masking, ROS, reactive oxygen species. Here, the student should know what is this reactive oxygen species, how an antioxidant help in various ailments. By scavenging this ROS, by blocking this ROS, by masking this ROS, by chelating with this ROS. So these ROS are free radicals which causes various ailments, which causes damage to the cells by means of causing cancer, causing blood vessel damage, causing various cardiovascular diseases, various skin diseases. So these free radicals can be suppressed, can be scavenged by means of vitamin C or any antioxidant substances which we are obtained from natural sources. Very clearly the students can remember this, and they can explain enormously in papers together by means of this. Knowing about what is this free radical, what do you mean by free radical, what do you mean by scavenging of this ROS, reactive oxygen species, which comes from the free radicals, causes various ailments and directly prevent the propagation of chain reaction that would otherwise leads to reduction in protein glycation. In animals, vitamin C also reduces diabetes-induced sorbitol accumulation and lipid peroxide in erythrocytes. So you can see the ROS, reactive oxygen species scavengers, are NADPH, uric acid, vitamin A, vitamin C, vitamin E, glutathione, beta carotene and polyphenols, etc. In these, which is more powerful scavengers to ROS? Vitamin C is more powerful, and 800 milligram per day partially replenishes vitamin C levels in patient with type 2 diabetic mellitus. Calcium, calcium, vitamin D, the role of habitat diet or diabetes risk identified high calcium intake as protective. There are theoretical grounds for suspecting that by suppressing secretion of parathyroid hormone, good calcium, vitamin D status may help to preserve insulin sensitivity and thus help prevent diabetic mellitus. So you should know this point. Apart from vitamin C and vitamin D, a role of habitat diabetic on diabetic risk identified high calcium intake as protective, and it has a suppression in secretion of parathyroid hormone. And vitamin D status may help to preserve insulin sensitivity and thus help prevent diabetic mellitus. Vitamin E is also an antioxidant. Vitamin E is an essential fatty acid vitamin or fat soluble, not fatty acid, fat soluble vitamin, and function primarily as an antioxidant. Low level of vitamin E have been associated with increased incidence of diabetes, and some research suggests people with diabetes have decreased level of antioxidants. Additional evidence indicates that people with diabetes may also have greater antioxidant requirements due to increased free radical production secondary to hyperglycemia, doses of vitamin E up to 400 international units are generally believed to be safe. Carbohydrates, this is an important point for the students to discuss. Carbohydrate, what is its influence in cooking and what is its influence in diabetic mellitus? Because we know carbohydrate metabolism is affected in diabetic mellitus, and it is the elevation of blood glucose level due to the carbohydrate intake and lack of carbohydrate metabolism. These all are general idea for anyone they may be knowing, but here the research says certain points have to be noted. That is, carbohydrates are the energetic substance related to the great impact of glycemia level. First point, the total amount of carbohydrate is the main factor responsible for the post-prandial response, but there are other variables such as type of carbohydrate, richness in fibers, the way of cooking. I am again pointing out that point. The way of cooking, degree of maturity, etc. That can play a role. The scientists have told that. We can see that point very clearly and see the scientists who have published a paper also. Most scientific societies recommend the individualization of carbohydrate contribution, agreeing with the fact that the diet should provide carbohydrate in the form of fruits, cereals, pasta, legumes, vegetables and tubers. They found that eating fresh cooked pasta causes the biggest rise in blood glucose. Eating chilled pasta causes slight lower rise in blood sugar glucose. But unexpectedly, the pasta that had been cooked, chilled and then reheated causes the lowest rise in the blood glucose level. So this shows that starch in different forms of cooking and different forms of their denaturing or different forms of the nature, it can be changed. This is the scientist Dr. Denise Robertson, senior nutrition scientist in University of Surrey, London, showed that cooking or reheating pasta is into resistant starch. They become into resistant starch. That wise, heating or cooking, chilling and then reheating, when you did with pasta, it showed a reduction in the blood glucose level. Should help in reducing the rise in blood glucose level. So she has published a paper in this website www.researchgate. Publication number also I mentioned in volume number 30, Practical Diabetes, she has published very clearly. Dr. M. Denise Robertson. Fats now. Current recommendation on fat intake for the general population, not generation, general population apply equally to the people with diabetes. Reduce saturated fat to 10% or less of total energy intake and cholesterol intake to 300 milligram per day or less. Research suggests monounsaturated fat such as canola oil and peanut oil may have beneficial effect on triglycerides and glycemic control in some individuals with diabetes. But care must be taken to avoid weight gain. You can see weight gain care must be taken when you are taking monounsaturated fat in the food. So triglycerides normal level also, as a pharmacist we should know that Optimal is below 150 triglyceride milligram per deciliter of blood calculation. Elevated is 150 to 200. Above 200, it is high level. And you can see when it is high level, the health risk associated with high triglycerides, heart diseases, pancreatitis, metabolic syndrome, type 2 diabetes. This all can be a cause for high triglycerides. Omega-3 fatty acids found in fish such as salmon and mackerel may reduce serum triglycerides without impairing glycemic control. So now fibers, foods rich in fibers such as fruits and vegetables are still recommended. Special mention is made of whole cereals. Fibers like present in the Brussels sprouts, broccoli, why not in papaya. Although the protective effect of fiber against some chronic diseases is well established, the effectiveness of the fiber in lipids and glycemic metabolism remains uncertain, still in research. For the general population of intake, 26 grams per day and 38 grams per day, women and men, that is recommended for men and women respectively. There is no reason to increase the fiber dose in diabetic patients. Chromium is it is a micronutrient in our body. Chromium is a trace element, trace nutrient, trace element that may be deficit in person with diabetes. So when it is deficiency in chromium, what all will happen? Delay in healing. The delay in healing in diabetic patients you can observe. Weakness of bone, unexplained weight gain or weight change or weight change, weight loss or weight gain, sometimes it happens. There will be weight change, usually weight loss. Affect optic health, eye, poor blood sugar control, poor concentration in your work, skin problems, neuropathy. These all symptoms which we have seen in diabetic mellitus patients due to deficiency of or due to lack of chromium when they are having diabetic mellitus. It has been suggested that chromium supplements may increase insulin sensitivity and improve glucose tolerance in patients with type 2 diabetic mellitus. Foods that are good source of chromium includes vegetables such as broccoli, potatoes and green peas. Whole grains product, broccoli, beef and poultry. Fruits including apples and bananas, grape juice, milk and dairy products can be used. Now coming to the magnesium, prospective epidemiology links magnesium rich diets to decrease risk of diabetes with an inverse correlation between magnesium intake and fasting insulin levels, suggesting an improvement in insulin sensitivity. So you can see decrease in magnesium level, it increases the calcium and decreases the tyrosine kinase activity of the enzyme, so that insulin resistance is increased, blood pressure is increased due to metabolic syndrome like high hypertension, type 2 diabetic mellitus can be formed. So, magnesium having an impact in diabetic mellitus, so that magnesium can be improved to intake by nutraceuticals. Foods which contain magnesium, green leaf vegetables like spinach and kale in the picture, fruits, fig fruits, avocado, banana, raspberry, nuts and seeds, legumes, black bean, chickpeas and kidney beans, vegetables like peas, broccoli, cabbage, green beans, artichokes, asparagus, Brussels sprouts, seafoods, even seafoods can be added. Alpha lipoic acid. You remember about the first slide? I told we are discussing about all this point. Alpha lipoic acid and dihydrolipoic acid work in a redox couple. An electron donating molecule and its oxidized form. And together have other antioxidant property including chelating of transition metal and regeneration of other antioxidants such as glutathione, vitamin C, vitamin E. We have seen this word, that is scavenging of ROS, reactive oxygen component, can be scavenged by means of this electron donating molecule like alpha lipoic acid, vitamin C, vitamin E, glutathione. You can see that is alpha lipoic acid can be converted to dihydrolipoic acid. So what happens? Free radical scavenging takes place. This reaction, chelating of metals can be taken place. So you can see elevation of glutathione, regeneration of vitamin C and vitamin E can be also done by this alpha lipoic acid. So it is supporting for various antioxidants to be produced in our body. Protein repairing. So you can see this, how it is responsible for various ailments and especially for diabetic mellitus. Alpha lipoic acid has been shown to protect the retina against ischemia, reperfusion injuries in vitro and in vivo studies. Ischemic injury to the retina is considered to be one of the major cause of visual loss and occurs in diabetic retinopathy. So this can be reduced by means of taking nutraceuticals with alpha lipoic acid. A review of clinical trials of alpha lipoic acid in the treatment of diabetic neuropathy reported beneficial effects on acute symptoms and disease progression. Alpha lipoic acid is a natural protective antioxidant like vitamin C, vitamin E, glutathione. Many foods of alpha lipoic acid is very low amount. They include spinach, broccoli, yams, potatoes, yeast, tomato, Brussels sprouts, carrots, beets and rice bran, red meat, particularly meat, organ meat is also source of alpha lipoic acid. This is just a picture to show about yam and sweet potato very clearly. Yam is a dry, starchy, flesh, dark bark like skin, but in sweet potato it will be mostly fleshy and variation in the color and as well as slightly appearance in the skin also, sleek, that is sleek like skin which can be peeled off after cooking. This is Brussels sprouts, very interesting, having many antioxidants of alpha lipoic acid. Now we have to talk about vanadium. The research indicates that vanadium acts similar to the insulin in transportation glucose into the cell, and it therefore valuable for both with type 1 and type 2 type of diabetic mellitus. Vanadium supplements also decreased fasting glucose levels. And talking about HbA1C, that means HbA1c is a test which is always we are talking about. It is hemoglobin A1c levels and cholesterol levels. So when we see HbA1c levels, optimum is 5.7 percentage. That is 5.2 is the very optimum minimum, and if it is above 5.7 to 6.4 it is elevated, but 6.4 means it is high glucose level. Even total cholesterol, which we have seen, that means it should be 200 milligram per deciliters of is a normal, and above that elevation will be taking place. Optimum is only 200 cholesterol, and above 240 is high cholesterol level. So when your person is having HbA1c high level, then you can see the red blood cell picture which I have shown. Normal A1c, that red blood cells glucose particles are seen very 1 or 2 dots in there. But extra glucose are coming into the deposit in the red blood cells as shown in the picture in high HbA1c levels. So dose ranging from 45 to 150 milligram per day can be useful for improving fasting glucose level when you use vanadium. Some individuals experience mild gastrointestinal distress either during the first week of use of high dose levels up to 400 milligram per day of vanadium. So vanadium is not only for diabetic action, you can see its main importance. It can have an anti-diabetic action. It can stimulate histamine release from mast cells, toxic and cytotoxic action. Vanadium stimulates oncogene expression, acting on the anti-cancer effect, and inhibits oxidative drug demethylation, stimulates noradrenaline release from the pulmonary artery, and stimulates bone cells proliferation and bone collagen synthesis. And vanadium mitogenic action is there, and in vanadium neoplastic transformation is there, and it is responsible for animal growth totally. The best food source of vanadium are mushrooms, shellfish, black pepper, parsley, dillweed, beer, wine, grains and grain products, and artificially sweetened drinks. Vanadium exists in several forms including vanadyl sulfate and vanadate. Vanadyl sulfate is most commonly found in nutritional supplements. Now the next one is about protein. Protein intake for diabetic mellitus patient is very common. Proteinous products and nutraceuticals are commonly available. Why? So you know proteins are made up of amino acids, and the dietary proteins are also can supply amino acids from a protein which you are taking. So what it will do? It has pancreatic nutrition sensor, and it has endocrine cell expression nutrient sensor. So pancreatic nutrient sensor, it can cause insulin and glycogen production. Endocrine cell expression nutrient sensor can produce incretin production. What is this incretin? Incretin is also endocrine secretion in the small intestine, which causes the stimulation of insulin for the metabolism of carbohydrate. So incretin, indirectly it is also produced by the protein intake, which helps for diabetic mellitus in insulin resistant patients. So current evidence indicate people with diabetics have similar protein requirements to those of general population, about 0.86 grams per kilogram per day. Although protein plays a major role in stimulating insulin secretion, excessive intake should be avoided as it may contribute to the pathogenesis of diabetic neuropathy. So that you should remember. Some evidence suggests eating vegetable protein rather than animal protein is better for reducing serum cholesterol and managing neuropathy. There are a number of different types of protein. Supplements including liquid protein supplements, protein powder and liquid protein shots. Source protein supplements include whey, casein, soya, rice and egg. Whey, we know, this is the picture. Whey is a nutrition protein rich liquid expelled from curd during the cheese making process. The picture shows very clearly it's a serum that's having very good effect. Soya is also having, which we can take an intake for the protein use content. And because brown rice offers slight more protein, most rice protein supplements are derived from it. Rice protein powder is made by grinding up rice grains and treating them with an enzyme that separates the starch, that is the carbohydrate, from the protein. So this also can be processed. Now we are coming to the coenzyme Q10. Coenzyme Q10 is a promising nutritional intervention of insulin resistance, at least among subjects with hypertension. Coenzyme Q10 dosage 60 mg per day, lower glucose and fasting insulin levels, suggesting possible empowered insulin resistance. So coenzyme 10 is an enzyme which is having more responsibility. You can see the picture which I am showing, dotted lines and an arrow, a solid line. The solid line demonstrate efficacy, and efficacy in evidence the dotted lines. So like neurogenetic diseases, kidney diseases, human fertility, metabolic syndrome and diabetes, these are having evidence of effectiveness can be seen the coenzyme Q10. Other things are demonstrated. Indirectly they can act in the cardiovascular disease, mitochondrial deficiency syndrome, inflammation, and you can see aging health protection. So primarily dietary sources of coenzyme Q10 includes oily fish such as salmon and tuna, organ meats such as liver and whole grains. Most individuals obtain sufficient amounts of coenzyme Q10 through a balanced diet, but supplementation may be useful for individuals with particular health condition. Food sources of coenzyme Q10: organ meat, heart, liver and kidney, some muscle meat, pork, beef and chicken, fat fishes like trout, herring, mackerel and sardine, vegetables, spinach, cauliflower and broccoli, fruits, orange, oranges and strawberries, legumes, soya bean, lentils and peanuts, nuts and seeds, sesame seeds and pistas. So these are some of the pictures about pistas, cauliflower, oranges, broccoli, and about the strawberry. Fishes, salmon fish, tuna, these are very common fishes which is available. Mackerel, trout, herring, sardine, anchovy, these all are some of the most having vitamins and most interesting foods for diabetic with coenzyme Q10. And you can see in L-carnitine is a drug which is even it is an nutraceuticals. It gets prescribed in the form of Merck. Merck is having carnitine LC tablets are available. So levorotatory carnitine, L-carnitine, beta hydroxy, gamma trimethyl aminobutyrate, a natural vitamin like compound, is an ubiquitous constituent of mammalian plasma and tissues, mainly distributed among skeleton and cardiac muscles. You can see in the picture, it shows a diet can give in a bloodstream. It can enter into various, you can go for heart, skeletal muscle, kidney and liver. And what it is that L-carnitine in the diet, once it enters in mucosa and it enters into the liver and it is converted to TMA, that means trimethylamine, and FMO, flavone, liver flavone, monooxidase enzyme converts this into trimethylamine oxide, and it can go for the helpful for control over stroke, heart attack, and even for death by means of atherosclerosis, which can be prevented by L-carnitine. So L-carnitine is supplied through dietary sources, example meat, dairy products, and by biosynthesis of lysine and methionine. You can see this picture also very clearly. It has shown the students can write numerous points by means of how an oxidative stress can be controlled by these nutraceuticals, and it can be helpful for various ailments like DNA damage can be caused by oxidative stress, lipid peroxides can be increased by oxidative stress, sperm quality and sperm count can be reduced by oxidative stress. So antioxidants can also increase, catalyze glutathione or glutathione peroxidase increases, peroxidase deaminase increases. So what happens? Reduces the oxidation stress and DNA damage can be controlled, lipid peroxidation can be controlled, and you can increase the sperm quality and number of sperms, and infertility can be controlled by means of this L-carnitine, which can be given continuously for the patients who is having diabetic in a young ages. Supplementation studies have shown that L-carnitine promotes insulin sensitivity and has lipid lowering action. The role of L-carnitine in mitigating oxidative stress and lipid accumulation in the insulin sensitive skeleton muscle in a well characterized model of insulin resistance. The L-carnitine supplementation may have some benefits in patients suffering from insulin resistance. Red meat has the highest level. A 4-ounce beef steak has an estimated 56 milligram to 162 milligram of carnitine. The carnitine is also found in smaller amount in chicken, milk and dairy products, fish beans and avocado. Vegans, non-vegetarian, tends to get less carnitine from food, but their bodies usually produce enough anyway by itself. Levocarnitine is used to treat a lack of carnitine. Carnitine comes in two forms. Levocarnitine, L-carnitine, should not be confused by means of L-carnitine from label like vitamin DT. Only L form of carnitine is used in the body in the treatment of serious carnitine deficiency. Evian LC tablets manufactured by Merck India consist of levocarnitine 150 mg and vitamin E 200 mg. Like tablets are available, and jar pack of Lipoic is also product available. And Nutraceuticals LC is also a folic acid, levocarnitine and methylcobalamin are active ingredient in the following ratio. Levocarnitine 500 mg, folic acid 1.5 mg and methylcobalamin 1500 microgram. So these are some of the plants which we told which are having anti-diabetic activity, like Acacia arabica. It can be called as in Malayalam that is Karuvalam. In Tamil you can say it is also sometimes Karuvalam, same word. And this Acacia arabica, commonly it is called babul, acts through release the insulin from pancreatic beta cells, which accounts for the hypoglycemic activity. It is Acacia arabica. And Angle marvelous, these also fruits which we might have seen very commonly in Malayalam, Kolokam or Kovalam or Vilvam, usually Vilvam fruit they used to say, Vilvam. And increases utilization of glucose either by direct stimulation of glucose intake or via mediating or enhancing insulin secretion, and also decreases in elevation of glucose and glycosylated hemoglobin levels. Allium sativum and Allium cepa. Allium sativum, we know that it is a garlic, strong antioxidant activity and rapid reactivity with thiol containing protein responsibility for hypoglycemic property. Allium cepa lowers blood glucose level and has potent antioxidant activity which may account for the hypoglycemic potential. And the next one, aloe vera, everybody common name is very common, and also another plant which we know, Anomosa squamosa, very interesting fruit. We used to say custard apple also. And aloe vera maintains glucose homeostatic by controlling the carbohydrate metabolism enzyme, stimulating insulin release for pancreatic beta cells. And Anomosa squamosa, that means you can see that is custard apple, lowers blood sugar level directly. And Artemisia pellens is called as common name Davana, and inhibits the glucose reabsorption and increase the peripheral glucose utilization. And Astraea indica, common name neem, it's Astraea indica is very clearly we can say inhibits the action of ephedrine and glucose metabolism, results in increasing utilization of peripheral glucose, and exhibit hypoglycemic activity without altering the serum costid oil concentration. And these are the plants which we have discussed actually. Artemisia pellensis, Nilampula in Malayalam, and we can say about most of them very commonly used in our area. And we can see even Nilavembu, Andrographis paniculata is also a plant, very interesting plant. The flowers will be in the top like this, and a small plant, prevents glucose absorption for gut, and we were using for even antiviral action in the coronavirus also. It has an antioxidant activity and increases the immune power, with may responsible for the beneficial of diabetic state. And this one, that is Biophyta sensitivum. This looks like Doxena, but it is not Doxena, it is Biophytum sensitivum. It is also Tentinae and Mukuti in Malayalam. Stimulates, that is Biophytum sensitivum, family Oxalidaceae, and stimulates pancreatic beta cells to release the insulin. And beta vulgaris, name it is beetroot, everybody knows. Beta vulgaris is lowest blood sugar level. And Brassica juncea, kadugu, that means also that is also having increased the concentration of hepatic glycogen and glycogenesis, and suppressed the activity of glycogen phosphorylase and glyconeogenic enzyme, leads to reduction of glycogenolysis and glyconeogenesis. This can be proved in Brassica juncea. And Cassia auriculata, everybody knows, it's common in our place, in the roadsides. Suppresses the enhanced gluconeogenesis during diabetic and enhanced utilization of glucose through increasing glycolysis, in addition to pronounced alpha glucosidase inhibitory action, resulting in an significant and potent lowering of blood glycemic response. So this is what a class which I have given. Please go through it, please listen to it and have a discussion and improve, and this will help you for the normal life. You can suggest your patients in your home and nearby about diabetic mellitus and about the nutraceuticals application, and how to avoid diabetic mellitus and how to sustain with the disease with a healthy life for attaining. Thank you for being this class. I hope you have understood, and you just repeatedly listen and also subscribe my channel. Thank you.